Question: A 50-year-old woman presents with a sudden, severe headache, nausea, and vomiting. She describes the headache as the worst headache of her life. On examination, she has neck stiffness and photophobia. A non-contrast head CT scan is performed, which shows subarachnoid hemorrhage. What is the most appropriate next step in the management of this patient? A. Immediate lumbar puncture. B. Initiation of anticoagulant therapy. C. Neurosurgical consultation for craniotomy. D. Initiation of antihypertensive therapy. The most appropriate next step in the management of this patient with subarachnoid hemorrhage is A. Immediate lumbar puncture. A. Immediate lumbar puncture. This patient presents with a sudden, severe headache described as the worst headache of her life, nausea, vomiting, neck stiffness, and photophobia. These clinical findings, along with the non-contrast head CT scan showing subarachnoid hemorrhage, strongly suggest a ruptured cerebral aneurysm, which is a common cause of subarachnoid hemorrhage, SAH. The rationale for choosing immediate lumbar puncture, option A, is as follows. Confirmation of SAH. A lumbar puncture is essential to confirm the presence of blood in the cerebrospinal fluid, CSF. In SAH, the CSF typically appears bloody, indicating a bleed into the subarachnoid space. Identification of aneurysmal rupture. Lumbar puncture can help identify aneurysmal rupture as the cause of the SAH. The presence of xanthochromia, yellow discoloration of the CSF due to breakdown of red blood cells, can further support this diagnosis. Planning for aneurysm intervention. Once SAH is confirmed, the patient should be urgently referred to a neurosurgeon or interventional neuroradiologist for evaluation and planning for the treatment of the ruptured aneurysm. This may involve endovascular coiling or surgical clipping. Options B, C, and D are not the immediate next steps in the management of SAH. Initiation of anticoagulant therapy, option B, is not appropriate in the acute phase of SAH. Anticoagulation can increase the risk of bleeding and should only be considered after the aneurysm has been secured. Neurosurgical consultation for craniotomy, option C, is important but should follow the confirmation of SAH through lumbar puncture. The type of neurosurgical intervention will depend on the findings and location of the aneurysm. Initiation of antihypertensive therapy, option D, may be necessary in the management of SAH, especially if the patient has significantly elevated blood pressure. However, this should also come after the confirmation of SAH and under the guidance of a neurosurgical team. In summary, the immediate lumbar puncture is crucial for confirming SAH, identifying the cause, ruptured aneurysm, and planning further management, making it the most appropriate next step in this case.